appraisal reports and in regards to the information that you had submitted, and I'm delighted to tell you that you are being designated as a magnet hospital.
I just am so proud of all of you. I mean, you have really done it and made it for this organization and make it for patient care. Every day you come in and make a difference. And I just really appreciate you.
24 hours a day, 7 days a week, 365 days a year. Patients at VCU Medical Center, facing the greatest challenges and the most profound joys of life, have someone at their side, ensuring the best possible outcome. When VCU Health System learned that its nursing program achieved magnet designation, ranking it among the best in the world, all manner of emotions swept the institution.
I screamed. It's one of probably the most ecstatic moments of my administrative career. The effort was so Herculean that it was a moment of triumph. I think it was unprecedented.
I've been on the Magnet Steering Committee, so I was a part of the process, at least to some extent. I was proud. I mean, I feel like we were already Magnet before I even heard of Magnet.
We worked very hard. We deserved Magnet. We already knew that we had practiced evidence-based practice, professionalism, excellent nursing care, so it was great to get that stamp of approval.
VCU won the Distinguished Magnet designation by achieving specific benchmarks contained within a concept called Forces of Magnetism. The health system had to prove that nursing care here soared in 14 difficult-to-achieve categories rooted in the areas of leadership, professional development, and quality of care. VCU Health System nurses carry out the Magnet philosophy every day as advocates, interdisciplinary teachers, and decision makers. The VCU Health System is like few others in the country. Urban-based and deliberately set up to care for the most diverse patients and illnesses. We pride ourselves in being able to deliver care in more than 200 subspecialty areas of medicine. That requires the best trained and most knowledgeable nurses.
First, it takes a nurse who is compassionate, and that's exactly what we have here. Nurses that really care about the patients that they take care of. And as well, a person who is inquisitive, who really wants to learn. Working at the VCU Health System is like working in a learning laboratory. And I believe that's one of the key reasons that we attract the best people.
Teamwork that we see on a daily basis between all of the disciplines. We have a great group of doctors and nurses and pharmacists and all the disciplines working together to give the best care possible. I think nurses are really encouraged to look at cutting-edge treatments for their patients and always kind of pushing the envelope to do more and to do it better and as quickly as possible so that we're always in the forefront of care, both in Virginia and in the country.
VCU Health System has a strategic vision that places it in a position of preeminence in the Mid-Atlantic region in providing the state-of-the-art care. But at the center of that strategic plan are our people. We recognize that our people sit at the center of everything we want to accomplish.
Better, better, good.
In the 21st century, a nurse has an unprecedented level of responsibility toward patients. Each nurse must have a level of autonomy to be as effective as possible. That requires a significant investment in the skill level advancement of every nurse. At the VCU Health System, that investment is a reality.
We're their first line of communication with the patient, so if it wasn't for our skills and their knowledge, then, you know, they probably would have a hard time managing all these patients. So I think that's that, and we're constantly being educated.
The fact that it's a teaching hospital, they help you, they pay for classes so you can further your career. They want you to advance in your career, and that's important that they're supportive. So it means a lot to be a part of a hospital that actually supports a nurse in advancing in a career.